We are honored to be joined by Dr. Suja Mathew, Executive Vice President, Chief Clinical Officer at Atlantic Health System. Good to see you, Doctor.
Oh, it's my pleasure to be here, Steve. Thanks for having me.
You got it. We're taping at the end of September. We'll be seen a little bit later. Where are we, A, with COVID, B, for people who want to know, COVID shot, the vaccine, flu shot, do them together. I know I'm loading a lot of things up, but everyone in my family has questions, and it's not just my family. Talk to us about COVID first. Where do you believe we are, even though it's a moving target?
Yeah, certainly it's a moving target. I think that we certainly continue to see COVID. We see it in our hospitals and our clinics and in our communities. Our relationship with COVID is very different today than it was years ago. Our patients that we continue to see are coming in with COVID, in addition to coming in with other processes as well that we care for. We're proud to be able to give the vaccine, the booster, the bivalent booster, both Moderna and Pfizer, to our communities. So we're ready for that, and we encourage members of the community to come get their vaccine.
You know, the question, is it over? The president was actually asked this question recently on 60 Minutes. You're smiling because I'm sure you heard it and everyone came and asked you, is it over? Who says it's over? Is it the head of the CDC? Is it the President of the United States? Is it the Chief Clinical Officer? What does over mean?
Well, I think it's different. It's hard to say that it's over, that anything's over. I think we're going to be interacting with COVID for a very long time. But fortunately, our interaction, as I noted before, is markedly different than it was 2 years ago. So,
we can't break up with COVID?
Sorry, we can't break up. There is no divorce from COVID. No, COVID is.
I should not be making fun. I'm sorry. It's just, I apologize, Doctor.
No worries, Steve. I understand. No, we're going to need to learn to live with COVID as we've learned to live with other challenges in healthcare over centuries. And so COVID is another one. We're luckily in a different place. We know what we need to do to manage COVID, don't we? We know what protections we need to take as individuals, as a healthcare system. We know so much more today than we did when this process began over 2 years ago. And we know how we can protect ourselves and the people that we care about. So we encourage, if you're eligible for a vaccine, certainly for the primary series, if you're eligible for a booster at this point, go out and get it. Protect yourself and the people that you care about.
Dr. Mathew, we've done a fair amount of programming, and we'll continue to do it, talking about the so-called healthcare heroes for whom the first year, we recognize them, we had parades for them, we applauded for them, we revered them, and then I don't know what the heck happened. The impact on physicians and nurses, with so many people directing their anger and frustration around COVID toward them, how much burnout and frustration are we talking about in the nursing and physician profession, A and B? Are they separate, or is it all part of the medical community? And there are others, and techs and others, who are very much part of the process as well. I'm sorry, loaded question, I know.
No, and a very appropriate question, and I'm glad you asked it of me. It's not all the same, I think. Let me just first acknowledge, Steve, that it's not just doctors and nurses. It's everyone that's involved in healthcare, and we must acknowledge all of the members of our healthcare community because they each play an incredibly critical role in the care of patients. But pivoting to doctors and nurses, doctors and nurses have unique challenges participating in healthcare today in 2022, but there's certainly some commonalities. Healthcare worker burnout was a real thing before the pandemic. It was an issue. It's hard to work in this job. It's incredibly rewarding, and I am so glad, I have the privilege of working in this field, but it's also very challenging to deal with the issues that we deal with day in and day out. So it was an pre-existing problem, and the pandemic heightened it. And we were able to respond quite heroically in the beginning, but like any challenge that's prolonged, it takes its toll on individuals. And so here at Atlantic, we're very mindful of that. We have a number of processes and systems in place to help support all of our healthcare workers, our physicians, our nurses, and again, importantly, every other person in our organization that plays a critical role in taking care of our communities.
Just to clarify, Atlantic Health is an underwriter of our healthcare programming. Doctor, let me try this. I'm curious about an issue that some might say, well, that's not a medical or clinical issue, but food insecurity. We have a limited amount of time left, but you're very concerned about that and have taken specific actions in that regard. Please talk to us.
So it's a part of who I am. I have had the opportunity to know health inequity from not only my professional experience in a public health system for a number of years before joining Atlantic, but also from deeply personal experiences, and that shapes who I am, why I do what I do, where I do it, with whom I do it, all of the things that make me me. Food insecurity happens to be a issue that has just garnered a great deal of my attention and now my passion around that. I've had an opportunity to develop programs around delivering healthy food into patients' homes. I've participated, volunteered, on the front line of delivering food and providing food in more pantry-like situations. And then on a different realm of that battle, I've had the privilege of helping shape policy around food insecurity. I am on the board of regents for the American College of Physicians, which is one of the largest specialty-based physician organization in the country, where I had an important role in shaping some of our policy. I serve with the AMA, and I also co-chair a group called Doctors for a Hunger-Free America. Food and the other issues related to poverty play such an important role in the overall wellness of the communities that we serve. So yes, it's something I feel very passionately about.
Well said. Dr. Mathew, I want to thank you so much for joining us.
Well, thank you, Steve. Appreciate it.
All the best. I'm Steve Adubato. That's Dr. Mathew. See you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare. Choose New Jersey, PSC&G, Rowan University, Johnson & Johnson, Robert Wood Johnson Foundation, MD Advantage Insurance Company, the Port Authority of New York and New Jersey, and by New Jersey Sharing Network. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by BestofNJ.com.
Hi, I'm Dr. Sharif Elnahal. Did you know that there are nearly 4,000 New Jerseyans waiting for a life-saving transplant? And 67% of those people are people of color. Just one organ and tissue donor can save 8 lives and enhance the lives of over 75 people. Let's come together to raise awareness in our diverse communities. Donation needs diversity. You have the power to make a difference. For more information or to become an organ and tissue donor, visit www.njsharingnetwork.org.